Well, I have an impossible task, and that's to introduce Arun Gosain and to detail his achievements, his academic achievements in 7 minutes or less. So for approximately the last 40 years, Arun has focused his clinical practice on pediatric plastic surgery and craniofacial surgery. He has also run a full-time research laboratory focused on craniofacial biology, and he is one of a few plastic surgeons who actually have NIH funding. He's been an officer, a chair, or a president of every major plastic surgery organization in the United States, including the Plastic Surgery Foundation, ASMS, and the Plastic Surgery Research Council. He's been Teacher of the Year, he's been Mentor of the Year, he's been Clinician of the Year wherever he has gone. He's published over 30 peer-reviewed publications. He's edited or co-edited 9 textbooks. He's written over 60 book chapters, and he has an H-index of a mere 50. But that's so very dry. What really makes him tick? What is the essence of the man? And I would propose that it's his passion to treat the less fortunate, his passion to treat the underserved, his passion for global health, and his advocacy for diversity. If there's 2 words that I would use to describe Arun Gosain, it's hard work. A point in contrast. A number of years ago, Arun came to Cleveland. I didn't know him very well at that time, but I had heard some very good things about his teaching ability, and I'd known he was doing some very, very good things at University Hospital of Cleveland as far as the residents were concerned. So we were at a dinner together, a combined visiting professor dinner, and I went over to introduce myself. So I put out my hand and I said, "Arun, congratulations on becoming program director." Well, he looked up at me and smiled and said, "Jim, I'm not the program director. I just do all the hard work." So Arun came from India as a young boy, and he acclimated himself to the United States very, very early. He also became interested in medicine at a very young age. Legend has it that his mother took him to see the doctor when he had a sore throat, and he got a shot of penicillin, and he rapidly got better. Well, then he thought, well, if he can do that for me, maybe that's something I should do for others. But he never forgot his roots, and here he is with the Indian Association of Plastic Surgeons. He's made lifelong friends for these people and with these plastic surgeons, and keeps very close ties. But a word of caution, don't ever get in a flag football game with him, and I certainly would not get in a wrestling match. Here he is with his varsity wrestling team in high school, and he went on to a very successful varsity wrestling career at Princeton. In high school, he was a computer whiz, but at that time was also when he first heard about the groundbreaking work that was being done at NYU by Joe McCarthy, and this became his passion. He's exquisitely trained in plastic surgery at Medical College of Wisconsin. He stayed on there to do a hand and microsurgery fellowship, then went on to his NYU craniofacial fellowship, and then came back to Wisconsin for a number of years. Here he is with David and Sherry Larson and his beautiful wife, Smita. But of course, his professional passion really is craniofacial surgery. This allowed him to combine his work with his global health work with treating children with facial anomalies. It's also where he was able to build a lifelong friendship with his mentor, Dr. Joe McCarthy. Global health. This is just one of the many trips that he made with Don Mackay. Also in this picture is Jordan Steinberg, Kathy Henry, both who were residents at the time of this trip. They both went on to craniofacial fellowships and ultimately are practicing pediatric craniofacial surgery. And of course, there's Tiba. Along with facial reconstruction, we need to reconstruct the psyche and the self-confidence, and that's exactly what these two did. And here is Tiba with Arun at the time when she was a guest speaker at his PSF presidential address. And then here's Tiba presenting her face to the world in her book, A Brave Face. ASMS, 74 presidents, 73 women, 73 men, and 1 woman. Arun was chair of the nominating committee when Delora Mount was named president of the ASMS. In 1983, he married Samita. She became his advocate and his advisor for the next 40-odd years. And of course, the apple doesn't fall far from the tree. Here is Samita and Arun with their son Sankalp also graduating from Princeton. But not to be undone, Siddhi, their daughter, she's graduating here from Brown, and she went on to get a law degree at Georgetown and is now a very successful lawyer in D.C. Well, Michael Jordan may have said it best, but Arun Gosain also says, there is no I in team, but there is an I in win. And here is Arun with his team of medical students, laboratory residents, and a few older guys. So Arun, I am in awe of what you've done for children with facial anomalies. I am in awe of what you've done for plastic surgery, and I am absolutely in awe to be your very, very dear friend.
Or we can get one at the end. I think not here. Thanks. So I will initiate my presidential address. For all of you who have been APS presidents, you know how much work was put into this and how much thought. And I remember speaking to Jim 10 years ago, and I said, Jim, if I'm the president of the association, I know what I want to talk about. And he said, what? I said, the unsung heroes, and that's what I'm talking about. So we have a number of sung heroes in our specialty. That's what our specialty is. You just saw that through the entire opening ceremonies. Organized medicine is built by physicians who've gone the extra mile to promote their specialties. And there's so many opportunities to recognize those physician leaders as we have just done, and those are certainly our sung heroes. The association, every single one of you, your membership here is predicated by having gone the extra mile. Every one of you is going to be a hero, and every one of you is either a sung hero or has the opportunity to become that during your careers. And in honor of that, I want to mention 2 past presidents who are retiring within the next month. Michael and Kim Bentz. Michael and Kim, you see on the left what you're more familiar with at the formal association dinners, and then on the right what you're going to be less familiar with as they look into their new life together. Nick and Susan Vetter, again, great presidents of our association. Again, the more formal picture, this was taken at Europs last year, and the less formal picture, and I didn't have enough slides to show all of them, but you're going to see Nick on a sailboat quite a bit, and that's going to be their futures. So could I have Michael and Nick stand for us? So those are sung heroes, no question, and there's others who are retiring. I just wanted to focus on our past presidents. The But our role as sung heroes wouldn't be possible if we didn't have those who got us here, and many of them are really not often recognized properly. So how can we recognize those who provided the foundation for our success? I'm going to go into a series. Is it possible to go into presenter view? Let me just see how you do that. Can I ask audio visual? If you're controlling that, can you guys put it on presenter view for me? Yes, please. That's great, thank you. So starting with our patients, the patients may have a lifetime with low self-esteem, particularly our craniofacial patients, if you think of them if we did nothing for them. It's the perseverance on their part and gaining the trust in our surgical abilities to change their facial configuration that can be life-changing. And if the world judges a book by its cover, we as surgeons have the ability to rescue that cover, as you saw with Tiba, who then became the cover of A Brave Face. The ultimate goal of every plastic surgeon, whether you're craniofacial or not craniofacial, is to erase the disfigurement to allow patients to live out their self-worth.
Thank you for joining us today. What led you to pursue a career as a musician?
What kind of led me to be a musician was actually the isolation that I had from being bullied at school. It was kind of a way for me to escape and kind of go inside my head. And then with all the time that I spent on working on my music, I realized in hindsight that I got pretty good at it. And since then, I'd use that as like a self-esteem boost. Because I've had a very, very, very low self-esteem for quite some time. And since then, the music has helped me to keep me above line, but still try to keep myself humble enough to, not have that big of an ego.
What obstacles did you encounter during this career pursuit? And did you sense any biases based on how people perceived you?
My obstacles were kind of being given a chance to perform. Unfortunately, as much as I would hate to say it, a lot of people do judge a book by its cover. It wasn't until I started my own band that led to a lot of the judgments with my appearance, and they didn't really give me a chance right away. I think that was kind of one of the biggest biases that I've had, was the fact that they kind of look at me and they kind of already have an idea of who I am instead of talking to me.
What recognition makes your pursuit satisfying to you, and has reconstructive surgery improved your sense of recognition?
I think what's satisfying is probably after about 2 decades of performing, now most of the people who now see me since the surgery, they see me fresh, so they see me as who I am and not my cleft. Since that surgery, I have had less migraines, and I've been able to sing a lot better. Between some of the physical things and how people have kind of looked at me and treated me differently for the better after the surgery, I think that's kind of what made it satisfying to me.
Thank you for sharing your story with us, Arun.
Yeah, no problem.
So you wouldn't know it by looking at that, but he started with severe mid-face protrusion, had to have a Lefort 2 advancement. It was so severe we had to do it by distraction, and really has impacted him. When we did that, he developed VPI, but he's a singer, so we went back and did VPI surgery. Now he's a singer who has a sense of self-confidence. Families of patients, our medical system is focused on patients and what they have to go through. We're so focused on the patients, but the patient families, particularly for children, have to make tremendous sacrifices, often requiring long-distance commutes to seek our care. Whereas the immediate reward is the patient, we have to recognize the tremendous investment made by family members to achieve their outcome.
Hi, Mr. and Mrs. Molinas. Thank you for joining me. Could you tell me, reflecting on everything you've been through, what do you feel have been your most important contributions as parents throughout Madeline's journey?
I think really being there as a family, as parents, supporting her, reassuring her, and finding the very best doctors to make sure that everything was in place that she needed.
Yeah, I would just say support, right? Time and getting to appointments, making a trip to Chicago. It's a time commitment, and just trying to support her.
Aside from facing challenges with supporting, obviously the logistics of traveling all the way out here, what other obstacles have you guys faced as parents, and how have you overcome them?
For us, with the distance, was a little trickier, but finding the right group, the right team, I think was probably the most critical.
That is totally right. I'm making sure that we had the best of the best to take care of our daughter and make sure that she was safe, the surgeries went well, and that she's healthy. And that those obstacles, just because we cannot find those teams where we live.
Overall, do you feel your roles and contributions have been recognized in a meaningful way?
Seeing the smile on our daughter's face, watching her, especially this year, even more so, look in the mirror and smile and just feel confident. I mean, she's a confident young lady, and everything is not an appearance, but she feels beautiful. She was always beautiful on the inside, beautiful on the outside in our eyes. She always felt she looked a little bit different, and sometimes that bothered her, and she feels much more confident. She's not embarrassed, and I think that's a huge, huge piece.
So their daughter, of course, had severe cleft deformities. I remember coming out of two-jaw surgery, and the first thing they told me is she'd just been accepted at the University of Alabama. So that was the product of all of the work that they'd put in, and they're so proud of her. Our nursing team is the fabric of healthcare. Many of the nurses, if you look at our nurses, they often juggle personal commitments. They often have to go back to school at a later age. Often they come back to the hospital, and there's a lack of respect from the physicians they work with for multiple reasons. You've all experienced that. But we, as the physicians supporting them, we have to remain cognizant of the hardships they've gone through to be there and make an extra effort to convey respect for their role in caring for our patients.
Hi, Noreen. What was your motivation in pursuing nursing?
I wanted to help others and take care of others.
Throughout your career, what obstacles have you encountered during this pursuit?
Just like any job, you have challenging coworkers, balancing life and work. And in my case, I went back to graduate school at 49, so I was balancing life, work, and school. But I've been one of the fortunate ones who's had great support from nursing management, and presently with my division head has been a phenomenal support.
Despite maybe some of these obstacles, what has made nursing a satisfying pursuit for you?
It has been my privilege to take care of these children, the pediatric population. It has been an honor to take care of these children. They're my superheroes.
That's amazing. Well, thank you so much.
Thank you, Catherine.
We really have to rely on patient advocates. If we think of advocacy and we all say, we're a member of this organization or that organization, our voice is not nearly as powerful to the legislators as is their constituents. So they're always going to look for that. So I want to use this as an illustrative voice, and Bill Hoffman will talk about it more tomorrow during our advocacy panel, but all legislation is patient-driven. The most convincing message to any legislator is that provided by their constituents. In 2018, Becky Abbott, who you see here, who is a mother of a patient with ectodermal dysplasia, contacted her legislator, Tammy Baldwin, who is the Wisconsin senator. Becky started the National Federation for Ectodermal Dysplasia, or NFED, and convinced Tammy Baldwin to draft the Ensuring Lasting Smiles Act, or ELSA, for coverage of congenital anomalies that would be mandatory for private insurers. ELSA has recently been reintroduced into the 119th Congress, as Bill Hoffman is going to talk about tomorrow, and is contingent upon physicians to recognize and support the efforts of our patient advocates.
Becky, would you mind telling us a little bit about the Ensuring Lasting Smiles Act and what inspired you to get involved in it?
The Ensuring Lasting Smiles Act, or ELSA, is federal legislation that would ensure that children and individuals born with congenital anomalies, particularly craniofacial anomalies, would receive health insurance coverage for the medically necessary repair of their congenital anomaly as long as that service is medically necessary.
What got you interested in getting involved with the Ensuring Lasting Smiles Act?
My kids are always the motivation behind my work and everything I do. My oldest son, Aiden, was born with a congenital anomaly called ectodermal dysplasias, And due to his condition, he's missing many of his teeth. We had many, many years of appeals and denials through health insurance to try to get medically necessary treatments so that he could get his missing teeth replaced and repaired. And due to those struggles, we decided to go to Washington, D.C., where Aiden was able to share his story and inspire the Ensuring Lasting Smiles Act.
I know that this has probably been a very long and difficult process for you. What continues to motivate you moving forward?
Aiden should be receiving his treatment soon and will most likely not benefit from this legislation. However, I've had the opportunity, the privilege, and just pure honor of advocating alongside the most amazing advocates, and their stories keep me going. Every time I hear of a parent who is unable to provide the money that is needed so that their kids can chew, swallow, see, hear, it breaks my heart. So I've made it my mission to work on getting the Ensuring Lasting Smiles Act, or ELSA, passed. I will keep fighting until it goes to the finish line.
What is it that we can do as a community to help support you and ultimately the passing of the Ensuring Lasting Smiles Act?
Every single person who believes that children and individuals born with craniofacial anomalies needs to share their story so that legislators understand how important this legislation is to them and that we can finally get it passed in this Congress.
It's so clear to me why you're an unsung hero, and hopefully we're making you a sung hero today. And we look forward to the passing of the Ensuring Lasting Smiles Act. Thank you. Thank you to you and your family for your efforts.
So for each of you, we'll have an advocacy panel focusing on some things that plastic surgery can have an impact on. But I'd ask each of you, because you have your own constituents, your own legislators, to take that on. Otherwise, it's going to, again, go from Congress to Congress. The administrative staff, the medical staff is essential in our ability to deliver health care effectively. Members of the medical staff may not have formal training in healthcare and thereby be overlooked in the hierarchy of top-heavy medical organizations. Whereas physicians often transfer for career advancement from one institution to another, the administrative staff is often the longest-standing employee serving a single institution. As physicians, we're the ones who are the best able to appreciate the importance of their roles and the personal investment they make to fulfill these roles.
All right, thanks for joining us. Would you be able to go ahead and introduce yourself and what you do?
Hi, yes, I'm Chrissy Green Rogers, the practice manager for the Division of Plastic Surgery, and I've been with the institution for 27 years, in healthcare for 30.
Wow, and what led you to pursue this line of activity? What inspired you?
What inspired me is really my mom. My mom had polio as a kid, and just her determination to all the successes that she's had in her career just helped me to guide the path that I wanted to pursue. And healthcare has definitely been one of the things that's been so enlightening.
Mm-hmm. That's true. And what obstacles do you encounter in your day-to-day? What challenges do you face in your job?
I think the biggest challenge for me is when we do not honor our mission, because we're here to service our families. It's vitally important that we stand behind what we say. All for your one is extremely important, and our job is to make sure that our families are serviced.
Yeah, that's true. And what do you find most rewarding about what you do, despite the obstacles in your day-to-day and challenges that you face? What's the most satisfying part of your job?
The most satisfying part of my job is seeing smiles on people's faces, getting those positive feedbacks from our family, from in the door, out the door, all of those accolades. And sometimes everyone is not happy. However, when I get involved, I'm definitely going to find a solution. So that makes my heart smile.
I love that. Thank you so much. And thanks for all that you do for the department and the institution. We couldn't do what we do without you.
Thank you.
So it's important to remember that we might be the primary caregivers and see the patient first, but the entire team has to be recognized because they all get the same satisfaction when a patient smiles.
All right, thanks.
Research scientists, I think we need to pay special attention. Physicians, when we talk about our compensation and everything, always complain about our salaries, our benefits, our retirement account, how much vacation time we're given. But we have a clinical base to support us. So it's a lot of it becomes somewhat, in my view, trivial. Where does that leave the research scientists? They're just as bright or brighter than us. Their salaries based completely on competitive grants. research scientists have made the tremendous sacrifice of prioritizing their love for discovery over job security. Our role in supporting them is to help them to direct their basic science skills towards meaningful translational research. That's why they choose to work with us. And then to facilitate funding opportunities to provide job stability. They may or may not have gotten the grant that they were writing for, but we also have our clinical dollars, we have our reserves, we have philanthropy. We have so many things we can put in their corner if we choose to do so.
So, Joanna, what inspired you to pursue a career in science which has a focus on plastic surgery?
Before joining my current lab, I had no idea that research in plastic surgery was even a possibility. It wasn't until 8 years ago, when I was introduced to the field, that I realized how much science could contribute to advancement in reconstructive surgeries. I became fascinated by the molecular mechanisms behind tissue expansion and how they could be harnessed to improve outcomes for patients, including patients undergoing radiation therapy. This newfound perspective inspired me to focus my career on uncovering ways to enhance skin growth and regeneration, combining my passion for science with a tangible impact in the field of plastic surgery.
So my next question would be, what challenges do you face as a researcher?
One of the biggest challenges I face as a researcher is securing extramural funding to support my work. The process of applying for grants is highly competitive. In addition, balancing the time and effort spent on grant writing with conducting experiments and mentoring students is another challenge. But it's a crucial part of advancing the research.
And what makes this pursuit fulfilling for you despite the challenges that you have faced?
Despite the obstacles such as the difficulties of securing funding or the long hours in the lab, the moments of discovery and progress are incredibly rewarding. Contributing to a deeper understanding of tissue expansion and its application in plastic surgery keeps me motivated, especially knowing it could lead to improved treatments for patients.
Okay, so that whole concept of a great scientist, but now having the application to actually do it in a translational fashion is a huge motivator, and we need to continue to tap on that. Surgeons in low and middle income countries, our patient base provides some form of payment for our services. It's not the case for surgeons who choose to serve in low and middle income countries. Those surgeons demonstrate a true desire to serve those in need, irrespective of the source of payment. And how can we, from resource-rich countries, help? One is, as I would suggest, we shift away from sporadic visits that basically serve to enrich the personal experience of the missionary or whoever is going, and make them visits to those countries that should be reciprocal learning opportunities for the resource-rich and resource-poor countries. In fact, we can, some of the things that I've learned most in cleft surgery, and Don Mackay is here, he can attest to it, have been overseas. Bresh Michelati was with us on one of those trips, but we learn from them. They do such a high volume, and even though we have some experiences they might not have, but they have techniques that we would never have used had we not visited them. So it has to be reciprocal. And then the next point that I want to make is we can actually help them in terms of looking at how to make their work sustainable. We can use a model for approaching government sources, looking at NGOs that might be directed towards them, and helping them to advocate into their local hospital systems.
Dr. Vyaslava, what led you to pursue this line of activity?
What drew me to global surgery is its potential to make a positive impact on population by addressing surgical challenge through a public health perspective. Beyond individual health, global surgery integrates teams of surgeons, nurses, anesthesiologists, and technicians, seeking improving infrastructure, equipment, and education. It elevates the entire system, ensuring long-term sustainable improvement in healthcare system. My passion for helping those in need, combined with a desire to make a meaningful difference, has driven me to strengthen the healthcare system. Global surgery offers a profoundly enrichment path for any surgeon, providing both professional fulfillment and personal growth.
What obstacles did you encounter during this pursuit?
The main challenge to global surgery is the lack of platform to promote and strengthen the surgical service with a public health approach. Other barriers include limited human and material resources, outdated hospital equipment, and poorly equipped operating room. Furthermore, disparity in access to care between urban and rural areas. These factors make it difficult to implement global surgery in my country, but not impossible.
And finally, what made this a satisfying pursuit despite the obstacles encountered?
The direct impact in people's life, the opportunity to improve long-term health through local training, the challenge and problem solving in difficult conditions, and the deep sense of purpose to come from contributing to social justice and health equity make global surgery not only an enrichment professional practice, but also a deeply rewarding experience.
Thank you very much, Dr. Vislava.
So that was Dr. Wislao from Peru and Dr. Bustamante with Operation Smile. Just to remind you, she said nothing about surgeons coming and doing their cases. We need to listen to what they need and respond to that, and not just go there and say, here I am, let me do your cases. Surgical educators, none of us would be here without surgical educators, and I want to highlight the fact that they take on the practice patterns of their role models, transfer those skills to the next generation, and that's a transfer that can't be gleaned from textbooks or videos. But education, as you all know, is often the least recognized leg of the tripartite stool with research and clinical advancement. And so there are fewer tangible rewards than clinical service and research. And as the present generation of educators, we must recognize those who educated us and pass this on to perpetuate a love for education within our specialty.
So welcome, Dr. Matloop. Thank you for participating today. What led you to pursue teaching?
The desire to emulate role models in my career, mentioning few mentors like Dr. Rudy Gingras in plastic surgery, who is an excellent clinical teacher. In hand surgery, Dr. Graham Lister, who was a great thinker and academician. And in anatomy and microsurgery, Dr. Robert Acklin, who was remarkably innovative in demonstrating and simplifying difficult concepts. They inspired me during my academic journey and had a significant impact on shaping my career.
Okay, and what obstacles did you encounter in your pursuit of teaching?
One, balancing clinical and teaching responsibility. Time spent in surgery and patient care reduces the time available for teaching. Thus, one has to juggle clinical duties, research, and teaching. Another point, the lack of recognition for teachers by the institution, thus can lead to decreased motivation. Institutions prioritize RVUs in clinical activity over research or teaching. And finally, long hours and high pressure environment impact personal and family time.
And how did you reconcile those obstacles that you mentioned in order to continue your teaching career?
One of the hardest parts for me was juggling patient care with my passion for teaching. I often felt like there weren't enough hours in the day. What helped was being intentional with my schedule, setting aside special time for teaching and research as I would for surgery or patient consultation. Also, incorporating teaching instruction into surgery and clinical rounds made the process more seamless and rewarding.
And what made this overall a satisfying experience despite all of the obstacles that you've encountered?
Teaching allows one to have impact on the future of the trainee. Sharing knowledge with aspiring professionals is more than academic exercise. It shapes the skill, ethic, and perspective of those who will come and care for others. Satisfaction comes from seeing the trainee become competent and confident, capable professional who will go on to make meaningful contribution to the society and medical field. Additionally, teaching fosters a sense of purpose and continuous learning, encouraging critical thinking, innovation, collaboration. It requires the teacher to stay updated with advances in medical science.
Well, thank you for sharing your experiences. We truly appreciate it.
Thank you very much.
So that's Dr. Hani Matlub, and I have the triumvirate here. For those of you who know the history of the Medical College of Wisconsin, Hani Matlub was certainly the quintessential teacher, but he had Jim Sanger and John Youssef, and that was an unparalleled teaching group for microsurgery. Can I have the three of you stand? Hani, Jim, and John. So it's a triumvirate that will be hard to reproduce. I also want to recognize Joe McCarthy. I asked him to come, but he, because of personal reasons, was unable to, but another quintessential teacher. Finally, I'd like to focus on the philanthropists. Healthcare is one of the few areas of endeavor that inspire philanthropic support. If we were in business or other such things, people are not going to give us philanthropy to keep our business going. And physicians can harvest the power of philanthropy by demonstrating how the care they provide can be translated beyond an individual patient. So what do donors seek? Rarely do they really seek personal attention or self-gratification. Most of them seek a demonstration that their support is being used towards their desired intent of providing improved health care. And we can direct how they can best do this. It's not always indigent care. The immediate thing someone is going to say, okay, donations, indigent care. We as physicians, and if they have a trust in us, can say, this is where our greatest need is. Our greatest need might be in education. It might be in research. It might be in certain areas of making the division stronger. But that's something that we can communicate with them before the dollars are given so that we respect the intent of the donors.
What inspired you to contribute to healthcare in the way that you do?
About 20 years ago, we started a little family foundation. And simply put, we wanted to teach our kids how to give not only monetarily, but of themselves. You'd say, well, why healthcare? Biggest cause of unhappiness in children is poor health. And then if you peel the onion back and you say, well, what are some of the causes of that? Some of it is lack of access. Some of it is genetics. Some of it is compliance. And also a big part is they may not have had the experience of being treated by caregivers who really and truly care. Just recently, in the last, 5 years, we had an experience where our son and his wife, my daughter-in-law, got married and they were pregnant. And they went to their 20-week test, and they came back and were told that it had a cleft, maybe a lip, maybe a palate. They weren't sure. So they said, come on back and let's do a little more exhaustive test. I went with them for that. There was a young doctor there, and the kids were asking a lot of questions, and she scared the kids, made them think that there was a 40% chance any subsequent child would have a cleft lip or a cleft palate. And that could affect hearing and mental acuity and all this horror story. So we said, I'll tell you what, meeting's over. So in some small way, we were trying to contribute so others may not have to go through some of the things that we went through.
Did your contribution yield the result that you were hoping for, whether it's in terms of personal fulfillment, personal recognition, or whatever other outcome you were hoping for?
We don't want any recognition. No, it's simple. If you can try to make the world slightly a little better place by maybe affecting one life at a time. The kids have really gained a lot from their giving of time and some of the financial resources that we've shared. We funded a couple of nurse navigators. So any pregnant mom isn't going to go through a new young doctor sharing some scary things that perhaps were not appropriate. We feel very good about, in some small way, maybe making the trauma some other family might experience a little less severe.
What inspired you to contribute to healthcare?
Great. So I'm going to go back to our centennial history, and many of you who are the new members have our book, and you'll see the foreword by Jack Fisher, who's here. It's a specialty forged by war. The underlying principles of plastic surgery, we are a specialty born of adversity. It was after World War II, maxillofacial trauma, that Kazanjian, all these people came back and made the contributions to make us deserving of being a specialty. That adversity was a ground for innovation, and we've been the leaders in innovation in those principles that Kazanjian and others have established earlier. But how can we benefit from past hardships in forging our future plastic surgeons?
Hi, and a very warm welcome to this Giants in Plastic Surgery podcast. This is a series of discussions with influential plastic surgeons from around the world, reflecting on their journeys, looking at the hows, looking at the whys. What can we learn from their stories?
Do you think the experience that we've just talked about changed the way you interact with people around you with different backgrounds or who are different in any way?
Even in the lab, those experiences help to shape how you think about it. So that was my first exposure to real dedicated laboratory time. When I chose my laboratory, it was an extremity laboratory, and the reason I chose that is because the person who wanted to start the extremity laboratory had not had lab experience. He said, okay, here's someone who he's not in a very good standing in the general surgery program. He needs someone to work with. So he said he was taking me under his wing. I got to his laboratory, and it was just an old cluttered room. There was nothing. And so I saw the other people working. They were already on the first day carrying test tubes around, doing things. They got right involved into projects. I was trying to figure out what I was supposed to order to get even a rabbit into the laboratory. So that first 6 months of my lab experience really showed me that without a structure in the lab, that's why so many people lose their love for research. They might be investigators or innovators, but if we define it by what kind of lab experience you have, and that has not been their training to that point, it's a huge thing. It would be like sending your child to kindergarten and the kindergarten has never seen a child before. That showed me that structure and mentorship is so important, particularly when you're trying to start something that you haven't done before. And that realization from that point on has made it so important for me to see that our young people, whoever comes to a laboratory that I'm working in, get the mentorship and the support that they need right from the beginning. So you can all imagine, all of our trainees are going to be able to go out and do breast reductions probably after their first year, but how many of them are going to say, how can we do a better breast reduction? That's where the spirit of innovation and exploration come in that made us a specialty. So whether it's clinical or laboratory or a combination, we need to continue to instill that through a mentored approach because it doesn't happen automatically.
Hi, and a very...
So I want to now go into a more personal part of this as the unsung heroes who brought me to where I am today. My wife Smita, who's here in the audience, she had her childhood in Atlanta. Her father was doing his second PhD in neuroscience at Emory, returned to India. He had numerous publications in Nature and Science from a small university in India, which shows his perseverance. The immeasurable trust that allows Smita to serve as my lifelong guardian, something that it was a leap of faith, and certainly it's been something that has built my career to date. She was pursuing her PhD in immunology. She paused that to take on the commitment of developing our family. I'm just showing a picture from 2002 and 20 years later, 2022, our children early and our children later. And notice who's missing from those pictures. The children have grown and prospered in spite of me, not because of me. It's my wife Smita who's truly the unsung hero in our family. Smita, are you here to stand? Then I'm going to finish with my father's story and take it on to probably the story of so many of your own fathers. This is where my father started his elementary school in Talwandi, Musukan, which is a small village in Pakistan before the partition. This is 90 years later, so this is after all technology and improvement have set in over the past 90 years. My father set the standard for perseverance, and I've tried to emulate that throughout my life. He got out of that village and continued to get his education through scholarships and awards, and provided him the education to become an engineer. He came to the United States on a cargo ship because that was the most economical way of doing it. It gave him 6 weeks to travel. And during those 6 weeks, he studied on his first interview, which would be Con Edison. He got here, saved enough money to allow the remaining family members to fly to the United States, but he was a good steward of his funds. He realized that if I could get here right before my second birthday, there would be no airfare. So we made sure that that happened. As you saw with Smita's family, in the early 60s, Indian families in the United States were considered novelties. Just like Smita's group at Emory had done an article, they did an article on us. I never had another Indian child in my school until I went to college, and certainly Princeton has a large diversity of Indian communities. Here we are 56 years later, at my father's 94th birthday. Our story is only one of so many immigrant families who've impacted the association. For most of our fathers, there was no conference venue honoring their struggles. And if you ask my father at any time in his life, and I know he would have said the same thing were he here today, what is he most proud of? The answer was always, my boys. So I want to honor all of those who are first or second generation immigrants and have left their mark on the association. I have no doubt that their fathers would be as proud of their achievements as mine would be.
Sailing down behind the sun, waiting for the prince to come, praying for the healing rain to restore my soul. Just a tow ride on the run. How did I
So you can see time changes everything, and there's so many memories, but it doesn't change the belief and inspiration that our parents have given us to get us here. I want to end with a few final reflections. What's been the perception of the association by trainees and young surgeons? And I'll be a little more colloquial. My good friend Charlie Thorne, who many of you know, we were medical students together at UCLA. And I met Charlie again when I was a junior resident in plastic surgery. And he said, well, remember the research council are the young and active guys, and the association are the old farts. So then I said, okay, let's forget about the association because I don't need to deal with them. Dr. Larson, when I was a senior resident, had the foresight to bring me to the association. That was the first meeting I attended, and the lifelong impact of that meeting was having the ability to interact with those old farts who had defined the specialty. And that's what many of you are, and we've defined the specialty, but we want to be perceived as dynamic, and that's the challenge I'm going to give all of you. We want to change the perception of the association from an organization that was benefiting just a select few. As I mentioned, the Academic Scholar Campaign is a great campaign, but how many of us have really benefited from it, to one that benefits all of its members, and that's why we're launching this capital campaign. And remember, it's a specialty forged by war. World War II is over. We've got to figure out how to keep the association moving. And then how does the presidential address fit in? A lot of us think, okay, that's the climax of everything and that's all we'll remember. I want to postulate that it's the anticlimax. The future of the association is the climax. And I would like you to begin by welcoming all our students and resident attendees and helping them to become comfortable with the association and wanting to be our future contributors. Thank you.